Hello, and welcome to our live video presentation today. As you know, we have been going on and talking about depression. Okay, now we started by several topics, and today let's see the previous topics that we've been going through. These are very important topics that we have covered from the first time we started. We started by major depressive disorder, which is called depression. We went to persistent depressive disorder, dysthymia, and then we went to disruptive mood dysregulation disorder, which is in children mostly. And then we went to premenstrual dysphoric disorder, premenstrual dysphoric disorder. Yes, that is the topic of today, premenstrual dysphoric disorder, PMDD. And we have seen this is an issue of women, and it's very important when we talk about women and their cases. And this happens mostly in a menstrual period. No, the topic of today is premenstrual dysphoric disorder. Premenstrual dysphoric disorder. And we, we cannot start talking about the disorder when we don't know the normal thing that happens and what causes the the problem. As you can look behind me, there is a diagram today. We are going to see what is menstruation. Menstruation, because here we have premenstrual dysphoric disorder. Premenstrual dysphoric disorder. So we have to ask ourselves uh, what is menstruation or what is menstrual period. Yes, we ask ourselves what is menstruation. So that we can go down and know. And then we get to understand where menstruation happens. Yes, menstruation happens in the uterus of a woman who is a human being. And what is menstruation? Menstruation is the monthly shedding of the lining of the uterus inside, which is the endometrium, from the vagina. It is a natural part of a female reproductive system and usually occurs in girls and women from puberty until menopause. Yes. Mm. When it happens roughly every 28 days, can range from 21 to 35 according to your hormonal balance. Now let's get to know the the parts of a uterus. A uterus is what I have drawn here. Here we have seen uh, that let me push this here. Yes, that way. We have seen this is the uterus. The uterus. Yes, it's like this inside the pelvic region of a lady. Now, the endometrium. We have already talked about the endometrium. The endometrium is the inner part. The inner part, this part here, inner part, the red part. This is called the endometrium. 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 And then we have the other part, the myometrium. Hmm? Endometrium, the muscle. Myometrium. Myometrium is a muscle. So when we are talking about myometrium, we are talking about this one. Myometrium. Myometrium. And then, yes, you see that? That is the uterus. This is the inside of the uterus. We call here the fundus. Fundus on top. The fundus. fundus is on top, and we call this is the vagina. Vagina here, and then this is the cervix. This is the cervix, and we have the fallopian tube. Fallopian tube. Fallopian tube. And then here, mostly, we have the ovaries down here. Ovaries. This one is the ampulla and the fimbria. Fimbria are this finger-like. Fimbria. Fimbria. They are finger-like projection that you are using when you have conceived. They take an egg and then it goes up to down here. See that this is the normal part of a lady. Now, what happens when you are having menstruation? The inner lining of the uterus flares off. We will see very shortly how it flares off. Now, let's continue about menstruation. We have seen an overview about what it happens. Today we are talking of premenstrual. We are talking of premenstrual dysphoric disorder, which occurs in the luteal phase of the menstrual cycle. It occurs in the luteal phase of menstrual cycle. So there are phases of menstrual cycles. We need to know what are these phases of menstrual cycles that we usually have, so that we can know what we are dealing with. You see that we can know why this phase. Let's go through the phases faster and faster a bit, so that we can know what we can learn, or what we can know how to handle these issues. Now, the menstrual cycle phase. Now, menstrual phase. It's better we write this down, so that person who is coming can ask a question in relation to what he has seen, or what is going on. Right? Yes. Okay. That is our figure. Now, the first phase, because it's a circle, let's go through it from the menstrual phase, when the woman is menstruating. Now, the first one is called the menstrual phase. Menstrual phase. When you are flying off, and the walls of the uterus are coming out, it's called the menstrual phase. Shedding of the uterus endometrium, inside endometrium, from the vagina. This is the menstrual bleeding period. Hormones that are here in this stage are estrogen, progesterone levels here are low. That's why you find you're having cramping. You need progesterone, helps when it comes to keeping your pregnancy. So if there is no pregnancy, it goes low, and then you flat. The second phase is called follicular phase. Follicular phase. Follicular phase. Follicular phase. Follicular phase is the second phase. The pituitary gland releases follicle stimulating hormone at this phase, which stimulates ovaries to develop follicles. Yes, at this follicular phase, the pituitary gland stimulates ovaries to develop follicles. What are follicles? They are kind of like balls. This is from day 1 to day 13. Yes, we started by menstrual phase, which is from day 1 to 5, and then we went to follicular phase, which is day 1 to 3 to 13. Sorry, one dominant mature for and prepare follicle matures. One follicle, it's a round ball, a follicle like an egg, matures and prepare to release an egg. Yes, it prepares to release an egg. The uterine lining starts to rebuild. You see, we have come from menstruation. We have come from menstruation from day 1 to 5. This is the 13th day, whereby now the 5 days we have been having a menstruation, and then this is the 13th day, whereby now the flying office uh, is being seen. Now we will see what is going on hereby. The uterine lining starts to rebuild. The uterine line starts to rebuild. Hormones, estrogen levels rise. Estrogen is high in women. It starts to rise. This happens, overlaps with menstrual phases at the beginning. Yes, at the beginning, this phase overlaps with menstrual phases at the beginning. Now, we after the follicular phase, because the egg has been released, now we go to ovulation phase. Ovulation phase is around day 14, 13, around day 14 when you are ovulation. What happens in ovulation? The mature egg is released from the ovaries, triggered by a hormone called luteinizing hormone. This is the most fertile period. When you want to get pregnant and conceive, this is the most fertile period because the egg has been released. It's been received by the fimbria. This one's the fimbria. It has been received because they dance like this. They grab it and then it goes inside this pipe of the fallopian tube as they dance, You see that? Very important, very important. And we see here, this is the most fertile period in the cycle. There is a surge in hormone. Luteinizing hormone comes. Estrogen peaks, slightly rising progesterone. There is a slight rise in progesterone. Now, as per our topic, yes, the disorder of depression. We are going to the next phase, which is luteal phase. Now, this is where the problems begin. Yes, this is where the problems begin. And why do the problems begin at this? The, these connections are going mad. Let me prepare them. Yes. We are talking about uh, premenstrual dysphoric disorder and pain physiology. We are going to learn how pain comes and how pain is going on through this period. Yes. Very important. Very important. Let's go. Okay, we were at the luteal phase. Luteal phase. Minute. We were at the luteal phase. Yes, luteal phase. What happens in this phase? This phase, the rupture follicle becomes the corpus luteum. The ruptured follicle becomes the corpus luteum, which produces progesterone to maintain the uterine lining. Yes, progesterone maintains the uterine lining. If fertilization doesn't occur, the corpus luteum degenerates. When we are talking about the corpus luteum, it's just a ball and mass of like an egg of blood and some uh, bo- uh, blood and some cells inside and some uh, balls like. Yes, if you know what a cyst is, it looks like that, round. Yes, that is the corpus luteum. Now we have seen if fertilization doesn't occur, the corpus luteum degenerates. Degenerating is destroys. Hormone levels here are progesterone and estrogen. Drop triggers menstruation. Progesterone dominates. If pregnancy does not occur now, progesterone peaks to prepare the lining. Yes, to make it good. It falls towards the end. Now we have gone through the phases of menstrual cycle. We have seen where you can be People usually ask, where can I be safe? By safe days. Now, your safe days are day one of menstruation, 1 to 5 days, or 3 days before menstruation, or in menstruation, or 3 days after menstruation. And I'm saying, if you have a regular period cycle, 1 to 28 days. Some people don't have regular menstrual cycle, and it may be hard for them to have the normal period. Yes, it may be hard for them to have normal period. Now, menstruation, let me go through the phases again before we embark in our topic today. It's four main stages. Menstrual phase, 1 to 5 days. Follicular phase, 1 to 3 days. Yes, and then ovulation phase, around 14, up at time of 14th day. Luteal phase, 15 to 28 days. 15 to 28 days. Yes, and then we go back to menstrual phase. Now, we were talking of depressive disorders, and we are talking about premenstrual dysphoric disorder, which occurs in luteal phase, in luteal phase of menstrual cycle before menstruation. Mood swing here, symptoms are mood swings, irritability, depression, anxiety, fatigue, sleep changes, and physical symptoms like bloating or breast tenderness. Don't ask your lady or your sister, or why are you moody when this time comes. Let's see what is happening at this phase. This phase is a very important phase, the luteal phase. What happens in this phase that makes our women become depressed or change in moods? Now, what is luteal phase? The luteal phase is the second of half of menstrual cycle, occurring after ovulation and lasting until the start of menstrual. It typically spans of 15 to 28 days in a standard 28-day cycle. You see, I've said 28-day cycle. Now, what happens in the luteal phase? Corpus luteum form after ovulation. Corpus luteum, the ruptured follicle which has produced the egg, yes, in the ovary, transformed into the corpus luteum, a temporal endocrine gland. A temporal endocrine gland. Yes, it degenerates after, it destroys after some time. Yes. We go to hormones. Progesterone and estrogen rise. You understand the work of progesterone and estrogen. We have said the corpus luteum secretes progesterone, and to lesser extent, it produces little amount of estrogen. Now, progesterone prepares the endometrium lining. Progesterone helps the endometrium lining to support a potential pregnancy, thickening, and it makes it more glandular to support a pregnancy. You see, but now, if fertilization occurs, if you conceive, yes, if fertilization occurs, the embryo produces human chorionic gonadotropic hormone, HCG, is produced. You see, so when you go and say, I want to test if I'm pregnant, this is the hormone that we test. Is it there? Because now, when there is conception, fertilization has occurred. That embryo is the one which will produce this hormone, HCG. So when we are testing about the hormone HCG, this is the hormone that we test. Is it there? If it is there at some level, we know, okay, now the embryo is there, this woman is pregnant. Okay, which may maintains the corpus luteum. You see that HCG maintains the corpus luteum so that it cannot destroy. It continue producing progesterone to support early pregnancy. Yes, 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 yes. This is a situation whereby fertilization has occurred. But if fertilization has not occurred, the corpus luteum, yes, what is corpus luteum? A ruptured follicle. Yes, the first. We saw a ruptured follicle. In an ovary, the corpus luteum degenerates into the corpus albicans. Albicans. You see, now it was luteum, it is now albicans. because now there is no fertilization and the embryo is not producing HCG. So corpus luteum has no sense to be there. It turns itself, it degenerates to corpus umbilical. Progesterone and estrogen drops because there is no fertilization, there is no embryo, there is no HCG hormone. So pregnancy it can't be maintained. Yes, we have seen what happens there. That is what happens in this phase of luteal phase, and we go now to to our problem. Yes, what is our problem again? Our problem is the mechanism, of of what we have talked about: premenstrual dysphoric disorder. Premenstrual dysphoric disorder. Yes, yes. Now we have gone through what this is. This is the uterus. We have seen the parts of a uterus. We have gone through the cycle of the uterus. We have talked about the luteal phase in perspective. Why? Because this is where the problem is. Premenstrual dysphoric disorder is mainly in the luteal phase. And what is premenstrual dysphoric disorder? Is a severe form of premenstrual syndrome characterized by intense mood disturbance, including mood swings, irritability, anxiety, and depressive and depression. These emotion symptoms, what do they do? The emotion symptoms and depression. These emotion symptoms are thought to result from abdominal sensitive to hormonal changes during the menstrual cycle, particularly involving neurotransmitters and chemical signaling in the brain. Yes, just a minute, just a minute. I'll be back, I'll be back. I'm handling something, I'll be back. Yes, I'm back. We are continuing. Yes. Sorry for that break. These emotions and These emotions and symptoms are thought to result from abdominal sensitivity to hormonal changes. You see, they are thought to be to hormonal changes during the menstrual cycle, particularly involving neurotransmitters and chemical signaling in the brain. We have gone through hormonal changes, we have gone through neurotransmitters, and to for today we still go through neurotransmitters. So a woman who is in menstrual period and is there seated and is there having moods, anxiety, irritability, and depression, we want to know what is the problem. What is the problem and what goes on towards this problem? One is serotonin. Serotonin is the main neurotransmitters involved in mood regulation. Serotonin is the main neurotransmitter involved in mood regulation. And as per our previous videos, you remember I said what? I call it happy hormone. It regulates your hormone. In this complication, estrogen and progesterone always fluctuates. They fluctuate, affecting serotonin levels, receptor, and functions. During the luteal phase after ovulation, A drop in estrogen and progesterone leads to reduced serotonin synthesis and activity. Yes. So you see, serotonin dysregulation. If you've been following from the other video, you know why serotonin. People have low serotonin, have mood changes. Yeah. Now, in this case, we see there is reduced serotonin synthesis and activity, contributing to mood swings. Hey, serotonin goes down, it goes up, it goes down. You see, mood swings, irritability, anxiety, and depression. But it's not serotonin alone. We have GABA. GABA is another neurotransmitter, GABA aminobutyric acid. GABA in the brain, main calming neurotransmitter. It calms someone down. Progesterone is metabolized into allopregnanolone, which is normal and has GABA calming effect. You see, in this complication of stress disorder, there may altered sensitivity to the progesterone that is metabolized to allopregnanolone. So there can be altered sensitization. This can cause paradoxical anxiety, irritability, and agility. Yes, irritability. At times you are just irritable. Hmm? This disrupts emotional regulation. It disrupts emotional regulation. GABA. Yes, we go to dopamine and norepinephrine. Dopamine, that you remember we said dopamine. Dopamine is a neurotransmitter that enhances pleasure, and norepinephrine that we called assisted to adrenaline. Yes, you remember that. These neurotransmitters help attention, motivation, and energy, having energy. Hormones changes, hormonal changes can reduce dopamine and norepinephrine availability, leading to fatigue, low motivation, and mood instability. Yes, and mood instability. Yes, we have seen all this, and the faces of the 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 faces of what can I say, of menstrual cycle we have seen, and we have seen uh, mood dysregulation mostly happens in the in the in this phase called luteal phase, in the luteal phase. Now, in the luteal phase, there are so many things that happen, and women always get cramping, they get all sorts of mood changes, and we cannot go away, we cannot finish this topic if we have not talked about physiology of pain in menstruation and associated hormones. We have to talk about pain. How does pain come in menstruation? How does pain come in menstrual period? Yes, we have to talk about pain. How does pain come? Yes. How does it come when you are flying or you are having that problem? Yeah. Menstrual pain occurs mainly during the luteal and menstrual phases. You get it? It occurs, those two phases are very complicated to women. They occur between luteal and menstrual phases of the cycle. And here is what happens. Endometrial breakdown. If there is no pregnancy, you remember, yes, the, the, the embryo has not formed, so embryo is not producing it's not producing any uh, any hormone that is sustaining pregnancy, which is progesterone. It is not producing what is called HCG from there to sustain corpus luteum, so it degenerates. You see, so menstrual pain occurs with luteal phase. Here it was happening. The endometrial breakdown. Endometrial breakdown. If there is no pregnancy, the corpus luteum degenerates. Progesterone and estrogen levels, they go down. They go down. We have seen that previously. This hormone drop leads to vasoconstriction of spinal arteries in the endo. endometrium. Vasoconstriction. Vaso is vessels. Vessels are arteries and veins. Arteries and veins. So constriction is called to constrict, to calm. Constrict is like atrophying, constricting. Relaxing is relieving, becoming big. Constriction is becoming small. Constrict, yes. So vasoconstriction is becoming small or tense of the vessels around the uterus, which are the spiral arteries in the endometrium. And when they constrict, what do? They cause ischemia. What is ischemia? Ischemia is lack of oxygen. Hmm? Yes, ischemia, a medical term that is used to explain lack of oxygen. Yes, they lack oxygen. They lack oxygen and shedding of the endometrial line. Ischemia and shedding of the endometrial lining. So this is what happens in ovulation. Why do you in menstruation? A very important part we are seeing here. There is no pregnancy. The corpus luteum degenerates because now there is no embryo that is producing progesterone, and it's not helping the corpus luteum to come up with HCG, even the embryo. So if there is no progesterone and there is no HCG, yes, the levels go down, even of estrogen levels go down. These hormones drop, leads to vasoconstriction because now progesterone is just there, and the arteries and the vessels around there, they are not being supported, so they constrict. When they constrict, the cells around the uterus are not getting oxygen. So what do? The layer, the endometrium layer, this layer here, this endometrium layer, the endometrium layer, this layer here, this one, this one. There, here is where we have spiral. This is where we have spiral arteries that give oxygen and nutrients to that layer. So if they constrict and they get ischemia, they get no oxygen, what will happen? This layer dies, this one. Now, when it dies, it is forced to be removed, because now you cannot stay with something that is not getting enough nutrients in your body and enough oxygen. So here is where we see the ischemia and shedding of the endometrial line, because it's not getting enough oxygen and nutrients. Now, because of the vasoconstriction, we have said that arteries and those are vessels, and constriction is coming small. Yes, small, like vasoconstrict. You press and it becomes small. Now, there is another one. Now we are dealing with the physiology and mechanism of pain. Now we have come to a step whereby it has vasoconstricted, it is started to bleed, to be removed. There is a hormone or something called prostaglandin release. Prostaglandins are released from degenerating endometrial cells. When a cell dies, it releases prostaglandins. And you remember, the 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 cells now, because they are ischemic, they are not receiving enough oxygen, they are dying. So they are releasing prostaglandins. You see, if prostaglandins are released, and you know prostaglandins are those that I'm applying to one of you. Prostaglandins are responsible for pain. I will go slowly and explain. What are prostaglandins? Prostaglandins are a group of lipid compounds derived from fatty acids that are like hormones. Yes, they are not secreted by glands. No, there is no gland that secretes prostaglandins, but they are produced at the site where they are needed, often in response to injury or illness. So here we have seen our uterus is having ischemia. Our uterus is lacking oxygen and cells are dying. So if cells are dying, they release prostaglandins. Prostaglandins have a wide range of important role in the body, including pain and inflammation, fever, smooth muscle contraction, vasodilation, and vasoconstriction. We have seen what is vasoconstriction. So the opposite of vasoconstriction is vasodilation, blood clotting, and gastrointestinal protection. Mm. Mhm. We will not go to deep in details of the pharmacogenics, in pharmacodynamics. Now we go to continue with the physiology of pain. Uterine hypercontractility. Hypercontractility. You see, eh, when the vasoconstriction is happening of the uterine blood vessels, I'm going very slowly, we understand, it leads to ischemic pain. The contraction of the blood vessels and the walls, they lead to pain. They lead to pain. Sensitization of nerve endings contributing to cramping pain. Now, there are the nerve of the uterus, nerve endings. Hmm? You get it? What is the nerve of the uterus? Nerve endings that end here, nerves that end in the uterine wall. Hmm? There are some parasympathetic nerve and sympathetic nerve that are segments of T10 and 2 hypogastric plexus. Those nerves that are called hypogastric plexus. Hmm? They make someone feel pain because now they are being affected. They are being affected, and this is what is causing cramping, because the uterus is contracting to release the dead cells. Prostaglandin is being released, and when prostaglandin is being released, there is ischemic pain. Yes, because of lack of oxygen. The interuterine pressure. Yes, you see, hypercontractility. The uterine is contracting. It is squeezing to release, to release, to release. And you see, this is where the pain comes. You feel cramping. The uterus contracts excessively in response to prostaglandins. This increases uterine pressure, sometimes higher than arterial pressure, leads to temporal ischemic and pain. You see, we have seen how pain comes. We have seen prostaglandins, main derives from uterine contraction and vasoconstriction, responsible for cramping and systemic symptoms like nausea and diarrhea. When prostaglandins are released, you may have diarrhea and pain. Vasopressin enhances uterine contractility and further constriction. Vasopressin, this is a hormone that makes you feel the cramps, the contraction can intensify pain. They can intensify pain because they help the uterus to squeeze, to remove. And then we have oxytocin. Oxytocin promotes uterine contraction, more active during menstruation and labor. Oxytocin is released in your body. You know that is a woman's hormone. It promotes more uterine contraction. Estrogen. Estrogen is in high level, can increase prostaglandin receptor but declines the menstruation. Yes. Now we have seen how pain comes in our phase of menstruation phase. You see that how pain comes in premenstrual in this disorder. Yes, 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 yes. Now we go on. We have seen about um, hormone changes. We have seen about the uterus. We have seen about now to diagnose this problem. To diagnose this problem, we have to see or we have to get to know what to look at, so that we can see, say a woman has premenstrual mood disorder. At least first symptom must be present in the final week before the onset of menses. At least 5 symptoms start to improve within few days after the onset and becomes minimal or absent in the week post menses. These symptoms must reoccur for most menstrual cycles in the past years. Yes, at least one of these mood related symptoms are this. You see, these moods are marked affected liability, mood swings, marked affected liabilities like mood swings, marked irritability or anger. You see, marked irritability or anger. Yes, and then we have another one, marked anxiety or tension. Hmm? Marked anxiety or tension. Marked anxiety or tension. One or more of the following symptoms to reach a total of 5. See, at least one of these mood related first, at least one. Marked anxiety, marked depression or hopelessness, marked irritability or anger, marked active liability. And then we go to other one. One or more of the following symptoms. Which ones? Decreased in interest in activity, difficult in concentration, lethargy or fatigue, changes in appetite or food craving, hypersomnia or insomnia, feeling overwhelmed or out of control. Hmm? Physical symptoms, breast tenderness, bloating, headache, joint muscles. You see that? That is how you can see this person has this complication, this mood complication. And then we have uh, what is confused by this. Always, there is something that can be confused with this problem. We have hypothyroidism, bipolar, major depressive disorder. Those are the ones that can be confused with this problem. Yes, yes, yes. And then we have management. Management, always we look at exercise, improved mood and sleep, reduce caffeine, diet. You reduce caffeine, sugar, alcohol, and salt. Yes. Sleep hygiene and stress regulation is very important, very important. And then pharmacological treatment. These are drugs. Yes, the drugs are fluoxetine, sertraline, paroxetine. Why are we giving this? We are giving this to reduce the breakdown of serotonin and the other hormones. Yes. So that, when they go down, mood changes, serotonin, dopamine, and the other norepinephrine. Now, we saw about how these drugs work. Yes. If you are not able to purchase them over the counter, I usually say go to your doctor, get a prescription. Can be given daily or only during the luteal phase, can be given daily or not only during the luteal phase. Hormonal therapy, combined oral contraceptive, especially is very Pirino, dorspirillon, yes, very important. Yes, hormone therapy, gonadotropin hormone antagonist, e.g., leprolide, to suppress ovulation in resistant cases. If you suppress ovulation, you will not have these problems. We have seen how from ovulation to this the other stage occurs. Pain, you can use NSAIDs like diclofenac to stop the prostaglandins. Yes, diclofenacs, they work on the prostaglandins and they are non-steroidal. Yes. Diamides, alloproza, short-term anxiety used to due to dependency is risky. So you have to use this in short term. And then Cognitive behavior therapy, talk to them, be part of them, help them emotionally. When you are close to them, help them emotionally, try to make them happy. Yes, to increase serotonin levels so that they can be helped. Bilateral oophorectal, that is in severe cases, surgical cases. In severe cases, we do surgery, oophorectomy, the removal of the ovary so that we cannot be having the ovulation phase. Yeah. Usually, long hormone therapy is given after that. Someone asked me a question. Let me see this question. Is it true that is it true when you get you you get your first child pain will reduce? Yes. Hmm? Let me reply first. Reason for pain reduction. Me talk about this so every woman out there can know. Reason for pain reduction when you've got your first child. This is what happens. The uterine structure changes when you get the first child. During pregnancy, the uterus enlarges and stretches. After delivery, the uterus remains slightly larger and more relaxed than before when you had not got a baby. This leads to intense uterine contraction during menstruation. You see, less pain. It causes less pain. And then we have the cervix here. The cervix is here. The uterus is inside here. And we have seen cervical dilatation. During labor, the cervix dilates significantly to allow the baby to pass. After delivery, the cervix stays more open and less rigid. Yes, this allows menstrual blood to flow more freely, reducing pressure pileup and cramping pain. Yes, it reduces pressure pileup and cramping pain. Improved blood flow. You see now the uterus has relaxed and now you have improved blood flow. Postpartum, the blood supply to the uterus improves and prevents. Now, when you have improved blood flow, oxygen comes in. More oxygen comes in and it prevents ischemia that causes pain. Reduced prostaglandin sensitivity. Yes, pregnancy and childbirth may reset the endometrial prostaglandin level to reduce the uterus sensitivity to prostaglandins. The main pain causing chemical, that one, prostaglandin. And then we have hormone regulation. Hormone balance may shift after childbirth, sometimes leading to less prostaglandin production during menstruation. After birth, it may shift and you start producing less prostaglandins. Yes, because of massive production of the uterine and the, what do you call it, placenta and everything. So prostaglandin sensitivity becomes less. So when you have a menstrual period, the prostaglandins is reduced. Is reduced. Yes, 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 yes. Let's continue. Physiological and neurological adaptation. Physiological and neurological adaptation. After labor, women may experience high pain threshold due to exposure to intense pain and child labor. Also, nerve pathway involved menstruation pain might be altered or desensitization. Now we have seen everything. We have gone through our topic of today. We have seen what you can use, drugs you can use. If you have a question, if you are not online as you go through, you can ask your question later. But the drugs we have seen in this, you've seen Fluoxetine is important. NSAID as diclofenac is important to reduce, but the main key feature here, I think, is you reduce the prostaglandin release and you increase the happy hormones that we call them serotonin, and you are happy, and then you get antispasmodic buscopan. Buscopan is antispasm. It may help to reduce the spasms. Buscopan, hyoscine bromide, it may reduce the contractility. Very important. And if you have fever at this point, you may use what? Paracetamol. Thank you again. Topic of the day has been done today. There. If you have a question, you always do what is necessary. Just send as early as people send me, and then we talk about it at the beginning of the next session. Now, our next topic, next time, we're going to talk about, we were on, today we have talked about premenstrual dysphoric disorder. Next topic we're going to talk about is substance medication-induced depressive disorder. This is where we are going to see about alcohol, drugs, and other medication. Thank you very much and welcome. Good day.